Here you're going to put poison that causes lockjaw into people's faces in the pursuit of beauty. So on its surface, it sounds kind of crazy.
That's exactly how it sounded to them. Exactly. Then when I actually gave the first paper at the ASDS meeting, American Society for Derm Surgery meeting in Florida. And there was a deadly silence in the room. Normally there's a buzz.
Uh-huh.
Deadly silence. That was the first time I experienced that. And then people came up to me afterwards and said, "That's a crazy idea that will go nowhere."
Welcome back to the Technology of Beauty, where I have the opportunity to interview the movers and shakers of the beauty business. And ladies and gentlemen, today is no exception. You're not going to believe who we're interviewing today. Dr. Jean Carruthers, right here on our show. Thank you very much, Dr. Carruthers, for joining me. Appreciate it. How you doing?
Just great. Thank you very much. And thank you for the honor of inviting me to your show. I think it's really creative that you're doing it.
Well,
and I
thank
think
you
it's
very
really
much.
important that's done. Thank you.
Well, the honor is all ours, Dr. Carruthers. I appreciate it very much. Thanks for joining. And let's just start at the beginning. Where are you right now?
Actually, I'm up at Whistler, just north of Vancouver.
Uh-huh.
A great place in the summer for biking.
Yes.
And the winter, as you know, for skiing.
Yes, we've been there. Aaron and I have been there for summer and winter. And I need to, first of all, tell you hello from Aaron. I told her I was interviewing you today, and she wanted me to give you her very best wishes and so forth.
Thank you so much. And please give mine to her. She is wonderful.
She is. I'm very blessed to have her in my life.
Mm-hmm.
So thank you very much.
Special.
So, okay, let's start back. Let's talk about where were you born? Where did you go to school and so forth? Let's go right to the beginning.
Oh, my goodness. Well, my parents were immigrants to Canada from England after World War II. So I was born, they first of all landed in the prairies. I was born in Brandon, Manitoba. That's, if you think of something that's flat, Manitoba is really flat, like the prairies.
Uh-huh.
So I went to school initially there, and then we moved to Calgary, which is just close to the Rockies.
Yep. And
so I did school and high school there. And then after grade 12, we moved to Vancouver. So I started at UBC, University of British Columbia. So I did science and then medical school at UBC.
Okay. And then did you do a Durham residency?
No, I went to England to do an ophthalmology residency at Moorfields Eye Hospital. I was actually first at the London Hospital getting known, and then I spent 5 very happy years at Moorfields Eye Hospital, which is an amazing place. So I learned so much there. So I'm actually an ophthalmologist who's really also feeling very, very fond of every dermatologist and plastic surgeon. I sort of, blended all of this together. You
sure did. So let's see. You came back then to Vancouver, is that right?
Yes, Alistair, my husband Alistair is a dermatologist. He trained at St. John's Hospital for Diseases of the Skin in London.
Mm-hmm.
So we came back to Vancouver. And we could have stayed in London, but we wanted to have a family. So that it just would have been so much more difficult over there. So we had 3 beautiful sons, and now we have 4 grandchildren on top of the 3 sons.
Congratulations.
Partners, yeah.
So you and your husband were partners then when you came and started your practice? Is that right? Or I know you're ophthalmology and he's dermatology. Did you have the same office initially or not?
Not initially. Initially, we were still realizing that we were separate.
Okay.
Then I actually started to get interested in botulinum toxin. And at the same time, Alistair got interested in Mohs surgery, the Mohs micrographic surgery for the treatment of skin cancers.
Sure.
And it was a happy coincidence that he was accepted in 1982 for a fellowship at the Pacific, at UCSF in San Francisco, and I was accepted at the Pacific, the Smith Kettlewell Institute for Visual Sciences. Okay. And I worked with Alan Scott there. So that's how I got my early training in botulinum toxin, is from the genius himself, Alan Scott.
And was that initially for blepharospasm as opposed to wrinkles?
No, it was actually for strabismus.
Strabismus, okay.
Alan, I was also a strabismus surgeon. I was a strabismologist, if you want to call it that, straightening up misaligned eyes. I had been fiddling with adjustable suture surgery and all kinds of different ways to straighten eyes. And then Alan came along with this idea that you could inject botulinum toxin into one of the paired horizontal rectus muscles, and it would weaken it, and the other muscle would take up the slack. The eye straight. And then fusion, the ability to use the eyes together, which is we all have, or most of us have, in our brains, will then lock the eyes together again. It was brilliant. It was such a clever idea. But how do you get the juice in there? And that's where Alan's partner, Art Jampolsky, came in, because he designed an EMG machine. It's a little black box. It's not like those EMG machines that we know from neurology that are like Assyrian door gods. Yes. This is just a little portable guy with a 25 gauge, 1.5 inch needle, which was Teflon coated. So you could put a few drops of local anesthetic in the conjunctiva and slide this needle into the motor end plate, which is 1 inch back. So it takes good hands to do that kind of thing. Luckily on the face, the motor end plates are everywhere.
Right.
In the eye muscles.
And the muscles, right. Okay, so then how do we get from there, from strabismus, I'm having a hard time saying strabismus. How do we get from there to wrinkles?
Well, it was, you mentioned already blepharospasm.
Yeah.
And these poor people in those days, the only help they had was various drugs and oral drugs, which really didn't help them cerebrally, but did help with the spasm. And the other thing was surgery on the neck muscles. So these poor people are sort of spasmed up and their eyes are closed. And they are 20/20 vision, but they can't drive a car, they can't cross the street, they can't earn a living. And so Alan decided, it was his idea, that he would use some botulinum toxin on the orbicularis oculi. And that's a home run. Suddenly you've got people who are normal again. They could drive a bus full of other people. And it lasted 3-4 months. It's like a miracle. And for quite a long time, patients were seeing each other on, as they went through life, saying, I know what you've got. Because that person didn't know what they had and they didn't know something could be done about it. And these patients would go and tell them, you should go and see and tell, whichever doctor in that city was treating blepharospasm. So it was one of those patients. Now, usually when you treat a blepharospasm patient with botulinum toxin, they are so grateful. They are so polite. They're never late for an appointment. They're just amazingly, it just restores them to a normal life. So it's one of those patients who did a very unusual thing. She got angry at me. She said, you didn't treat me here, pointing to her medial brows. And I apologized to her and said, I'm so sorry. I didn't, because I didn't think you were spasming there. And this is the immortal line. Oh, doctor, I know I'm not spasming there, but every time you treat me there, I get this beautiful, untroubled expression. And so that's what I took home to dinner that night to Alistair. And remember, we've got 3 sons and all the chaos that comes with young kids. And so I don't know if it really sank in that by then we were sharing an office. So then I showed him the next day. Now, we just happened to have the most lovely receptionist, Kathy Bickerton Swan, who had now seen for several years all these patients of mine coming in, always grateful, always a great result, always everything's safe. And so she had really good frown lines. So we said, Kathy, how would you like to have us treat your frown lines? And she said, sure, whatever. she knew it was safe, and they didn't really bother her, but she, was a very positive person. And 2 days later, Alistair was a convert. And she's the lady who, we've published her pictures. I still communicate with her. She's not doing the treatments now, but it was so wonderful to see with just one patient, you could see that something really, really worked instead of hundreds of patients.
And what year was that?
That was 1987.
And that was patient number one for aesthetics.
Patient number one, yeah.
Darn, 1987. I have to make a note of that. That's crazy. Okay, so now you and Alistair see this. It's your employee. You see this miracle. And then who did you tell next? Or did you treat some more of your patients and then tell? Or what happened next?
Well, this is lucky because they're both academics.
Yes.
Decided to do a proper research study.
Okay.
So informed consent and, all the bells and whistles.
Mm-hmm.
And then there's the problem of recruiting patients.
Sure.
Because
to put poison in their face.
Yeah, these are really smart people. I had a terrible poison. I heard it's terrible poison. Why would you do that? So I said to Alistair, I've got some really good frown lines. Treat me. So he treated me, and then we'd hear this, oh, no, I couldn't. It's a poison. And then I'd pull out the picture of my huge frown lines before, and I'd pull my bangs back and say, what do you think? Mm-hmm. And they'd say, oh, do it. That was just like that. It was just instant. And I haven't frowned since 1987.
I bet. Yeah, in the pursuit of beauty. That's right. So your first study had how many patients in it?
Only 18.
Okay. And you followed them for how long?
We followed them for about 6 months. And we actually longer, a year, I'm sorry. And we had one patient who lasted about 11 months, but most people lasted around 3-4 months.
Did you find that most people came in every 3 months, or would they go longer?
Oh, we only treated them once and then followed them.
I beg your pardon. Okay.
Yeah.
So then early on, well, you mentioned the spasm patients coming in, I think you said about every 3 months by the clock because they were symptomatic. Did you find this early on? Did you find the same thing with the Botox for wrinkles, or would they last longer?
Well, I think that the spasm patients, they probably last initially about 3-4 months, but as you keep on treating them, they actually seem to get some biofeedback. And they last a little bit longer, maybe with the bilateral blepharospasms, maybe 4 or 5 months.
Okay.
It's a different story with the unilateral people, the hemifacial spasm, because you can't really treat them a full treatment on the spasming side because you just wipe that out and then this side they look too asymmetric. So you have to undertreat them and then treat them more often in order to give them a nice balanced look.
I see. Okay, so then you're doing the aesthetic patients, you put those people in, and then you report your study 11 months out, and you gave them one shot, one treatment. And then how did the community react, the large medical community, not just derms or ophthalmology, but just the whole medical community? Because it sounds kind of crazy. Here you're going to put poison that causes lockjaw into people's faces in the pursuit of beauty. So on its surface, it sounds kind of crazy.
That's exactly how it sounded to them. Exactly. Then when I actually gave the first paper at the ASDS meeting, American Society for Derm Surgery meeting in Florida. And there was a deadly silence in the room. Normally there's a buzz. Deadly silence. That was the first time I experienced that. And then people came up to me afterwards and said, that's a crazy idea that will go nowhere. And then
I love it.
How could you use something like that poison on something so frivolous as wrinkles? Dismay, disgust, anger, but you realize they're only saying that because they don't understand.
Right.
They haven't sort of absorbed it yet. So that is a big stimulus. So that's why we got really busy. And in the 90s and early 2000, well, we still are doing it, still educating people. It's a question of educating people who understand and then sitting back in amazement, seeing that what they're doing with it. You're learning from them as well. It's opened up this amazing channel of communication between, as you were saying before, dermatology, plastics, ophthalmology, ENT, facial plastics, neurology, you name it, physiatry.
GI,
yes,
neurology, all the therapeutic uses, neurology, neurosurgery. It's absolutely amazing.
It's a new community. It's a worldwide community because of this amazing molecule.
Amazing.
Yeah.
Well, what do you think about these new toxins we keep hearing about with longer duration? How do you think that's going to affect the market?
Oh, that's a really interesting question. First of all, I think that we've already seen with the recent high dose studies for Onabot, Ababot, and Inco, we've seen that by reducing the volume of diluent to half, you can double the length of time that the neuromodulator lasts. So the registration dose, say, of 20 units of Onabot will last twice as long.
By making it more concentrate.
Yes.
Less dilute.
Yes. Speaking about Ababot, John Joseph calls it big dog on a short leash.
John's in this community. I know him very well. In fact, he's operated in my operating room in Marina Del Rey. I know him very well. I've never heard him call it big dog on a short leash, but I can hear him saying that for sure. Okay.
Yeah. So I think we have to realize we already have 3 very long-acting neuromodulators if they're used the proper way, by reducing, not necessarily increasing the dosage, but reducing the diluent. That is an absolutely amazing thing. And we saw that with all 3 of those A neuromodulators. So now we look at the new kid on the block, Daxi. And Daxi is not yet approved. I've been in contact with Revance saying, hi, have you been approved yet? And the answer is, we're not telling you, we don't know. But I think that I did actually communicate with them and suggest that they did a high dose study themselves. And they said to me, well, that's a really good idea, but John Joseph already suggested that. So I think that there's a real new understanding. This is why I think we're learning so much about this amazing molecule, because what's in the syringe, it's not just the neuromodulator, it's the saline. And so we can adjust the effect, not only by increasing or decreasing the dosage, but we can adjust it by increasing or decreasing the diluent.
Okay. And isn't there also a peptide in the Daxi?
In the Daxi,
yes. Is that an active peptide, or is that just a byproduct of the production?
It's
is that what accounts for the longer duration?
That's what they say, that it actually is creating a climate where the molecule, I don't think it diffuses as much. It makes it a more focused treatment.
If one were to take a typical Botox, an Allergan Botox bottle of 100 units, what would one dilute it with in order to have the longer duration that you're referring to? How many cc's of saline, say? Yeah,
so Sue Ellen Cox was the lead author on the study, and she went from 2.5 down to 1.25 cc's.
Okay.
In the vial.
And that doubled the duration?
And that doubled the duration.
I'll be darned. So just the diluent, so that's more concentrated than I imagine. Are you putting in as much in every spot, or are you putting in less because the dose is higher per, say, cc or 1/10 of a cc?
Yeah, you're putting in less volume in each place.
Right.
But you're putting in the same dose.
Oh, you are? Okay, the same number of units.
Yes, same number of units exactly, and but half the diluent.
I'll be darned. That's amazing.
Yeah. So, I mean, whoever thought that would happen?
Yeah, exactly. Whoever thought?
Because I think it happened because of COVID and as a secondary effect of COVID, because Revance were all set to get their approval November 25th last year, if you remember.
I do.
And everyone was waiting with bated breath, and it didn't happen, and it didn't happen. And I don't know when, and I think the problem was because of COVID, that the FDA wasn't able to come and inspect them. So I'm hoping that that is over now, that we're seeing the American people so beautifully vaccinated. And I'm hoping that we see that soon. But that was the stimulus. It gave, that gap gave the other companies time to do a high-dose study.
So what do you see in the future then, as we compare and contrast Daxi with the other available toxins, neurotoxins? Do you think that Daxi will have any impact with its perceived longer duration, or do you think that the Botox, Xeum, and Dysport, that they will go the other direction and have different dilutants or concentrations? What do you think the future holds?
I think that this is a really fertile place for us to really investigate. For example, there's men. Now, men like to have a treatment that lasts at least 6 months.
Yes,
I've observed in my office.
yes.
Men are like, I'm busy. Don't make me wait in your wait. You know what I'm saying? So I think that there's a huge market that's untapped. Men are, I think there's 4.7 million men in Canada who are potentially interested in a neuromodulator. And so you've got to gross that up by 10 times in the United States, because your population is 10 times.
Okay.
Canada. So that's a huge marketing opportunity. If you could say to men, we have a neuromodulator, we'll give you a very elegant, refined result. You will look natural. You will look very handsome with this, and it will last you a good 6 months, maybe 7. I think you'd have men signing up for that kind of thing.
Okay.
Now, if you've got somebody who has, let's look at the other end of the market. Let's look at botulinum toxin E, which comes on in 24 to 48 hours and lasts 2 weeks.
Right.
Well, there's no high-dose study being done on that yet, or low-volume study done on that yet. So maybe you could adjust the length of time that the short-acting toxin works. Maybe you're in the Los Angeles area. Maybe you've got an actor or actress who has a particular role, and they have to change appearance during the role. That would be perfect for E. Just looking at that. Now, what about the regular people out there? They're happy with somewhere around 4 to 6 months, I think, because they also get fillers.
Yes, it's ideal duration, right?
Ideal. So if you could just make the neuromodulator last even another month, it would sort of jive with the filler and how long it lasts, and probably jive also with having other energy-based device treatments. And I think there's just so much new research that needs to be done. So I see the future right now as being really full of tons of research projects for everybody answering specific questions about particular unmet needs.
Yes.
There has to be something about the way the neuromodulators we have to date have not lasted longer than 4 months. That has to be part of the reason that men say, nah, I won't do it. So,
men are bigger babies, and we don't like to have sharp things in our face and needles stuck into us. And with women, beauty knows no pain. But with us scaredy cats like myself included, you come at me with a needle and I get jumpy. So if you could give it to me once a year, I'd take it.
There you go. There you go. Fantastic.
Yeah.
But the other thing that's happening, I think, more of the future is I think we're going to see continued hybrid working, so that it's Zoom or doom. And if you look at what's happened to all of us in the last 15 months, we've got very used to using Zoom to do consults with our patients, to do
Yes.
meetings like this, academic meetings like this, to have discussion groups. So then Stanford did the research and showed that 40% of the time when we're on a Zoom call, we're looking at ourselves.
Is that right? 40% of the time?
40% of the time, which is one of the reasons that Zoom has been so good for cosmetic businesses.
Absolutely. We talked about that earlier today when I was taping. And men in particular, let's pick on men a little bit. You know, men typically, historically, pre-COVID, would brush their teeth and shave in the mirror. So that was like 5 to 10 minutes a day. And now in this Zoom era, men are staring at themselves. I didn't know 40% of the time, but they're calling me and talking to me about their waddle here, their turkey deformity, their eye bags, their skin. And my business has exploded with male facial plastic surgery and non-surgicals, especially. And it's thanks to Zoom and the Zoom lift and all the other things we talk about, the tech neck and all these crazy things that are going on post-COVID and in the Zoom era. So I completely agree with you. It's fertile ground for sure.
Yeah.
Now let me check so I know you have a hard stop coming up. And first off, I want to thank you so much, Jean, for coming on to the Technology of Beauty. It is such an honor and such a privilege to have you on the program. So thank you from the bottom of my heart. Is there anything else you would like to tell your adoring fans before we bid farewell?
Well, I'd just like to get you to say a very big hi to Eric.
Okay.
And hope that I get to see both of you again very soon. And congratulations to you for this wonderful podcast.
Thank you so much. It's a ton of fun. If you think of people who should be on or suggestions for me, I'm open to any and all suggestions. It's an absolute blast to do it and get to know people better and put people together, industry, professionals like yourself, and even finance, and put people together. And I can't wait to see you and give you a hug. Tell your husband hello from Granto and Aaron, and have a lovely weekend. And I look forward to seeing you soon.
Thank you so much. Okay, be well.
You're welcome. And I'd like to thank all of you for joining us on this very exciting episode of the Technology of Beauty, where we had the opportunity to get to know Jean Carruthers. That's Dr. Jean Carruthers. And I look forward to seeing you each and every Tuesday on the Technology of Beauty. Stay well.